Sí
complex.
podremos
Only
hablar de
that way
acceso
we're going to be
universal
able to
inclusivo y
talk about
verdaderamente
inclusive,
equitativo en planificación familiar y salud
universal
sexual y
inclusion and HRSR, reproductive and non-reproductive.
And goodness, same question to you, and I suppose I'll take advantage that you are youth, and ICFP is a very formidable space for you as a young person. So how do you then see the challenges that emerge, but also areas of opportunity and innovation, especially in the geographical location where you are?
Thank you for that question. So, just the context to some introduction.
Gracias por su excelencia. Una presentación.
And also a co-chair of the ICFP 2025 Power Shifting Subcommittee. And when I think about what equitable access to contraception and reproductive health services mean, as a young person, as a woman, and also as an African and a Nigerian woman, it brings so many different complexities. And unpacking those means that we need to rethink who are we leaving out when we are designing programs specifically on contraception. For the longest time, many women in the room can relate to how many of the reproductive health services available or contraceptives seems like they are experimenting with your body. How are we designing and, producing these contraception and reproductive services that do not worsen the health of women, that do not feel like I'm scared to go to this health facility because I'm not sure if this procedure would give me some of the side effects that worsens my condition. So this goes to looking at it from the, say, private sector or the organizations or companies that produces these contraceptive services. But when we look at access, as a young person, some of the biggest challenge that comes to accessing reproductive services speaks to the stigma that is attached to requesting for reproductive health services. So how are we ensuring that these services are youth-friendly, that they are safe, that they are confidential, that in many remote communities where girls are not even allowed to talk about sex, not to talk more about contraception, we are ensuring that those barriers are being removed. And it is that we are thinking about it in a contextual format. Not that we think this has worked in, say, Tunisia, then it should work in Uganda. It is that we understand the dynamics of the community where we are implementing or working with, and then we are able to engage with them in that regard. Last year, I was in the Gambia, and I engaged with health workers and community leaders in the Central River region of the Gambia. Similar to some of my experience working in southern Nigeria, I realized that some of the biggest issues is that many of the young women who are not able to access contraceptive services, reproductive health services, have to navigate both religious and cultural barriers, and at the same time, the lack of autonomy and agency. But in the middle of community dialogues, we are able to understand the perception of, say, their husbands or male partners. We're able to understand the perception of the young people in the community, and how can we ensure that those barriers from the community level can be navigated and, removed to enable more access. When we also look at the health facility, I've spoken to youth-friendly service provision, right? In most cases, I've seen how when we create a youth-friendly center, we tick a box that, oh, we have been able to provide youth-friendly services. But some years back, we conducted a research through the Sustaining Evidence-Driven Advocacy Project to see what does youth-friendly services really mean. It is that many health workers do not even understand what it means to deliver youth-friendly services. They don't have the skill sets and the capacity. So not assuming that because the contraceptives are available, they are able to deliver those youth-friendly services. Those are some of the issues that affect access. Additionally, I also think that we need to be discussing with the users of these services. That is, how do we evaluate the long-term impact of this, right? So if you have been using a particular contraception for, say, 5 years, and you want to introduce something new, have we invested in understanding what the impact has been over time? I also think that one game changer for improving access is investing in self-care. Now, there's a lot of argument about how self-care takes away or it's more like putting the burden on the individual to manage their, say, sexual health or reproductive health, but that's not the case. It is that we look at it from a holistic approach, how that the woman, the man, the young person can be able to take ownership of their health and well-being. During my internship at the WHO, I spent quite some time working with the Sexual and Reproductive Health Department, learning about self-care strategies across various countries. And some of the biggest learning is that we save a lot of money when we invest in enabling individuals to be able to manage their reproductive health. And it comes with access to the information, access to the tools, enabling environments, and also ensuring that when they go to the health facility to get more information, they get the needed support. So these are some of the approaches. But I also think that when we talk about reproductive health services, we shouldn't forget some of the, I would say, marginalized topics, things like menstruation, right? How we are ensuring that women and girls can be able to access reproductive health services. Thank you.
Thank you very much, Goodness, for that. And Dr. Haddad, I invite you to make your intervention and opening remarks. Obviously, having worked in gender equity and the foundation, please share then with us some of the ways in which programming has been designed from your end and from your work in how you enable increased access to family planning goods and services.
Thank you so much, and bon dia, everyone. Thank you for joining us in this discussion around equity this morning. You know, when you come to the issue of and the place and the role of philanthropy, there are so many different ways in which capital shapes power and then shapes how work commences or what voices are given place and voice, who makes decisions, how decisions get made. And so for the Hewlett Foundation, the work around reproductive health with a particular focus on contraception and safe abortion is about 60 years old. So we're celebrating our 60th anniversary next year, and this is one of the oldest areas of work that we have done. And so over the decades, the work has also evolved, and now the Gender Equity and Governance Program, where the reproductive health work sits, has really been engaged in a deep set of inquiries around what does equity mean in the reproductive health arena. And so for us, that raises questions of who, how, where, and what we fund. And in answering those questions, we have seen some significant shifts happen in our programming over the years. We've moved towards flexible funding and general support as much as possible, which allows organizations and communities to determine their priorities. For our work in East and Francophone West Africa, we have moved resources to support organizations on the continent or offices of global organizations on the continent as much as possible. So 21% 3 years ago, the vast majority of our grantee partners are now on the African continent. In our work in the United States on reproductive health, we have moved from national organizations to really supporting state-based coalitions. We've also looked at our processes for how we ask for information, reporting requirements, language requirements, and so now everything is invited in Spanish, English, or French. And so these are some of the ways in which we have sought to shift the ways in which equity is put into action in our portfolios. You know, my colleague Janet Holt, who is sitting in the audience, who is one of our program officers for this work, could give you many more specific examples of how this is unfolding, especially in our work on the continent. But what I'd like to do is use my remaining 2 minutes to just share some of the inquiries, some of the curiosities that I have, that we have as a program at this time. The equity lens is one that demands recognition for a multiplicity of constituencies who are left out. who are not seen, who are not recognized within our current paradigm. I wonder what would happen if we shifted the whole paradigm to ask, how do we create the new so that we are not always trying to figure out how to fit refugees, people of color, rural communities, communities of diverse sexual orientations and gender identities, people in conflict areas. I mean, people with disabilities. We are always asking how to fit, I think, the vast majority of the world into existing paradigms that don't include them. What would happen if we really began at this time of disruption to start thinking about how we can shift the paradigm itself? The whole idea of capital, political, social, financial, collective, positional, is made up, right? We as human beings constructed all of these cultural realities within which we operate. And then we spend a lot of our time being in opposition to or trying to fix the current structures. What would it look like if we, alongside, started to use our imagination and dream in the structures where everybody flourishes as a matter of just how we create the thing in the first place? And so I know it's abstract, and since we made all of this up, why not make up something else that really speaks to our shared dignity?
And to you, Dr. Pascal Alotti, very similar question. And perhaps coming from the WHO, we heard opening remarks yesterday from Dr. Tedros and his support for this convening and your, of course, important work in SRHR over the years. How would you then locate perhaps that important scientific work that the WHO does in this space?
Good morning, everyone. I'm incredibly nervous. Can you hear me?
Yes, put your mic a little bit closer.
I'm very nervous, so I want you to work with me just for a second. Take a deep breath and center yourself in this massive room. And put your hand on your heart. Take your right hand and put it on your heart. Everything, I'm sure you can hear your heartbeat. I can certainly hear mine. Boom, 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 boom. Everything under your hand, no matter who you are, where you're from, whether you're rich or poor, whether you work for Gates or for a CSO, whether you're male, female, or non-binary, you are holding on to the only thing that truly belongs to you. That is what you had at birth, and that is what you take with you when you go to your grave. Sexual and reproductive health and rights acknowledges this fundamental truth, that this is the thing that you own, that this is your currency, and that others will desire that currency. And it is your choice to share this thing that you own with whomever you choose at various points in your life, through the intimacy of sexual relations or through childbearing and nurturing. That, colleagues, is the definition of power. And that is the power that this movement and WHO seek to protect through ensuring the integrity of that body with rigorous science and evidence to support governments, civil society, and partners in translating this evidence into policies and regulatory environments that ensure that everyone can exercise their sexual and reproductive health and rights. I have the honor of leading the WHO department, and everybody knows that we're in turmoil at the moment, so there's a lot of mergers. I'm leading the WHO Department of Sexual, Reproductive, Maternal, Child, Adolescent Health and Aging, as well as the UNDP, UNFPA, UNICEF, WHO, World Bank Special Program on Human Reproduction. We cover health across the life course with a mandate to make equity real in real people's lives. So at WHO and HRP, we approach equity as both a right and a responsibility. A right of individuals to health and autonomy, and a responsibility of systems to respond to the need. So how do we, just going to the question, how do we ensure equitable access to contraception and reproductive health across populations that are as diverse as humanity itself? One, design for equity and not for averages. For too long, health systems have been built around averages, average users, average facilities, average budgets. But averages hide inequity. And so we're working to embed SRHR within universal health coverage as an essential package, not as an optional service dependent on donor cycles. Equity means removing financial and legal barriers, eliminating user fees, for instance, and revising laws, and guaranteeing confidentiality for adolescents. It means recognizing that equity looks different for each age group. For a woman with a disability, it might mean access to a proper accessibility to a clinic. For adolescents, it may be to the right provider who listens, and so on. Secondly, deliver with dignity, the right method for the right person at the right time. Quality and choice are the most practical expressions of equity. And so through our work, we've seen again and again that when people are offered the right method mix with respectful counseling and follow-up, uptake and continuation rise. This is reflected in the updated medical eligibility criteria and selected practice recommendations that we launched yesterday, and ensuring that we emphasize person-centered care. We support countries through a bottleneck analysis to identify where choice breaks down, which commodities are missing and which populations are left out. Third, strengthening the workforce, because equity lives or dies at the point of care. We have to respect our midwives, nurses, and community health workers as the human infrastructure of rights. Fourth, data needs to service justice. Equity demands disaggregated data by age, geography, disability, and so on. And fifth, we need to make sure that finance is fair. Financial justice has to be about both efficiency and predictability, and WHO has just released guidelines for financing for health. Equity is a discipline of seeing the invisible, hearing the unheard, and acting with precision and humility. So in summary, we aim to design for equity, deliver with dignity, and fund with fairness. Thank you.
Thank you very much. And Amaranta, I welcome you and invite you to make your intervention. And just to note that you bring a really important aspect from indigenous peoples and all of the knowledge that often is not deemed as expertise. And I know from many years through your work, many of us have learned, have grown as young activists, and we really look forward to hearing what you think of equity, especially in this moment in time, through family planning and advancing SRHR.
Muchísimas gracias, Dr. T. Bienvenidas y bienvenidos a todos.
Thank you very much, Dr. Tate. Welcome to all of these in this great region of Latin America that is so beautiful, so complex at this time. Firstly, I would like for us to guarantee that equity, we need to name the communities, to name them, to name people, to call people by name. It's a policy. To name yourself like a woman, a kid, a child, an adolescent, from the indigenous, Native Americans, Afro, domicile workers, LGBT, trans people, and other identities of gender that were pre-existent, that are typical of this region and of other peoples, to name them and to name us in respect of the colonies, and a lot of braveness and political braveness. This is very important. Well, IPP Afro, we invite people to give them their rights so that people have a greater access to justice. We are all too convinced ICPF that the collaboration between the different sectors is a very powerful force that is going to allow us to advance furthermore in fundamentalisms. Fundamentalisms are just a pretext to be able to progress in those rights that we still have to conquer. We need, as was said yesterday in a plenary session, to unify a common beat in respect of the heart, a common beat where all can beat at the same time so that we can demand preventive medication, timely intervention with culture effect, innovate from new technologies that improve the timely access to a rubber, a preservative. But now we're saying that before we said we wanted to connect, we were now connected on the computer. We need to collaborate. It is an urgent moment of collaboration as a political act. And ICFP, in this region in particular, we are prepared for that collaboration, that community collaboration. Where are we innovating? Well, precisely as we said, Doctor, ICPF is innovating and bringing those peoples that are not talking, these Native Americans, the native communities that somehow they wanted to make them invisible, that they were camouflaged and get transformed in neo-colonialism, that at any rate many of the communities resist, and here we are. From IPPF, we bring pre-existent identity to the LGBTQ. I am part of the Musha community, gender identity of the Central Indigenous community, like Megitsin in Panama, Israel in India, and Fafafin in Polynesia, Two-Spirit in Canada, Berdage in the US. Many of those identities have not been mentioned in our communities. We believe thoroughly, faithfully, that cultural identity is a strategy as a community policy to achieve better access to rights and services. The historic recognition of these bodies are important because they require and demand being part of the planning of the public policies that we need to carry out. Now, knowing these bodies, these Indian bodies or native nation bodies are not in the millenary past, they're present here and today. Thus, joined with them, we need to turn political our discussion with the governments, with the cooperation agencies, and with our own communities to be able to progress. It is necessary to turn it political so that we can improve the contraceptive methods to improve our community, so that we cannot continue to infect our indigenous community with HIV, with a topic that is not very well recognized, that they recognize traditional medicine in an intercultural dialogue with Western medicine, to have access to new technologies, that they be culturally pertinent, and that they recognize these identities to be able to recognize the right to pleasure from the Native American communities. About 15 years ago, in Latin America, we started with the feminist movement, a green movement. Today, in respect of the fundamentalist movements, the movement should be of a lot of passion, and it must be turned red. Thank you very much.
Linking very important elements of sexual and reproductive health rights, gender-based violence, centering maternal health, including safe abortions as well. And so from your perspective and your organization, why is this work around equity important? Why is it important that you are here at ICFP and to foster continued collaboration as we all try to advance SRHR together?
Thanks, Dr. T. Do I have a mic? Thank you. And thanks to these amazing panelists and colleagues for setting such a comprehensive stage and inspiring me and all of us this morning. Malika, I'm ready to bust through some social constructs and let's just reset this, right? This is a time, why not? So at Agenda Health, our mission is to advance sexual and reproductive health and rights through high-quality programs and really meaningful, equitable partnerships that ensure lasting change. And we believe fundamentally that we cannot accomplish this mission and our goals without explicitly prioritizing the integration of gender, of youth, of social inclusion, all of these principles, core equity principles, into everything we do and every way we do it, from working with health systems to doing community engagement to doing policy and advocacy. It's not a simple checklist of do's and don'ts, all right? It is really a way of approaching all of our partnerships and all of our work. So for example, we've included for decades in gender health has included intentional partnerships with men as part of our work in access to contraception, in addressing violence, and in promoting gender equality. And we work with young people in all of their diversity to support their communities, their access to healthcare and the quality of healthcare they receive, and the policies that can be more responsive to their needs. And we focus on better understanding the barriers that people with disabilities face in accessing health services and securing their rights. And then we integrate disability-inclusive programming to meet the specific needs and support of people with disabilities. And that's a lot of words. But what do we actually do? So let me share a couple of examples. Pascal referred to data, making sure we have disaggregated data. You may have heard the phrase, measure what matters because what's measured matters. Sounds a little circular, but the point is that we need to track indicators that are meaningful and not just indicators that are easy to measure, because when we deliberately choose to measure something, we signal that that thing is a priority, and that helps us manage and improve our performance on that topic. So as an example of us measuring what matters to make sure that what is measured matters, in Tanzania, our Scaling Up Family Planning program, which we implement with support from FCDO and in partnership with CCBRT and Pathfinder and other local partners, it's the only program in the country that documents the contraceptive method choices of people with disabilities when they access health services. Meeting the needs of people with disabilities really matters to us and to our partner CCBRT, which is a Tanzanian NGO focused on rehabilitation and providing services for people with disabilities. And it's creating that measurement allows us to create a path for progress to ensure that needs are being met, that people are being treated with respect, that people are having access to the services that they deserve in a way that is centering them and ensuring that their comprehensive needs are met and that they have full access to their rights. As another very specific example, because there really are so many, but in Ethiopia, one of our projects has a youth advisory board. And the young people on this youth advisory board felt strongly that the project needed to teach sign language to healthcare workers to help meet the needs of deaf and hearing impaired clients of the family planning and contraceptive care program. And in this case, you know, the advisory board is an advisory board, but they're young people who are leading, and we lean into their leadership, their recommendations, their guidance, and with them provided this training. So centering, again, letting young people and people with disabilities identify their priorities and through the programs together meet their needs. This helps us get to more equitable care. So we have a lot of examples. I've loved hearing from other panelists. And the keys to me are these. We need clear principles. We need good tools. And then we need to do it. We need to build things with people that have traditionally been marginalized and support their access to care and opportunity. I mentioned good tools on our website at engenderhealth.org. We have our gender, youth, and social inclusion strategy and our tools and approaches, and they're freely available. We invite you to use them, to build on them, to improve upon them, to share your improvements back to us. Let us learn from you. But again, we need to have clear principles, we need to have good tools and data, and then we need to do it. Equity is something that we need to believe in and we need to do. It's an action moment for all of us now.
And thank you so much for those opening interventions. And I've just been writing down sort of like a word cloud of really inspiring things that you've all been saying. You know, gender diversity is important. We need to end stigma. We need to understand communities. Increased access. What do youth-friendly clinics actually mean in practice? What are state-based collaborations looking like? Being multilingual and operational support, much more than just pragmatic. I've heard that you've talked about designing for equity, not just average, and that we must be intentional about what we measure. Disability rights came through as an important topic. Financial justice, the political, indigenous peoples and intercultural dialogues and what it means for comprehensive SRHR and services. And of course, about having clear principles, bringing everyone along and ensuring that marginalized people are centered. In the second phase of our conversation, I want to just bring all of us around just a few challenges. And I think for many people, it's also where opportunities lie, where the creativities lie, and maybe where opportunities for collaboration for all of us in this room lie. In that, we know that universal health coverage is really a global compass for us all, but it will require investment in infrastructure, in equitable resource allocation, and even mobilizing in ways we have never had to in the context of the global cuts we are experiencing, and a bigger commitment to addressing the root causes of health disparities and inequalities in the very first place. And so with this second round of interventions, I would like to hear from you, from your vantage point, what are areas of opportunities that are emerging? You may contextualize, maybe give us one example from just this year alone and how the movement and SRHR has really been thrown off, right, with a major loss of resources and funding. But perhaps there are good stories and examples to tell already. And I don't want to use the word resilience because it's often projected onto people in really hard circumstances. But if it's something that you identify with, that you have been able to build that resilience, you may share that with us as well. So the question is both emerging challenge, but perhaps something you were able to change and turn into opportunity or creativity. And I will start and come back to you, Minister, for your interventions. And we will have about maybe 2 minutes so that we have everyone intervention in good time. Thank you, and over to you.
Gracias.
Thank you very much. Challenges in order to achieve a universal access to family planning and to every type of families are multiple and deeply interconnected with the social structure, the cultural and economic ones in our countries. It is not just about the availability of contraceptions of health services, but it is also how the inequalities, forced silences, and the historic exclusions have given a condition to millions of individuals, trans and non-binary, the normative and non-hegemonic norms that are being pregnant. Those bodies considered like adjectives because they are with a situation of disability. Those sexual paid activities and those who live in conditions of poverty are going through barriers, and they must have the right to decide about their lives. In the middle of the challenges are powerful opportunities. Innovation is just not only on the medications and treatments to those sexual transmission diseases or barrier methods or other technologies, but in the community participation models, policies recognizing the diversity of genders and bodies, comprehensive sexual education reaching areas that are very far apart, and those voices that have been silenced when decision-making processes are done. When you have focus in the politics and programs that are including and recognizing the diversity, heterosexualities, and LGTB. Otherwise, we will be the weird ones on the planet. Ages, context, experiences. We are closer to guarantee and equitable access. The opportunities imply to transform the family planning in an act of social justice and to recognize the human rights that everyone can decide when, how, to where in their own self-care without coercion, without tears, with a comprehensive support. Here is where equity stops being an abstract concept to turn into an instrument of dignity, freedom, and social transformation. We cannot just set aside the needs where there are genocides and those countries where now they are denying the access to the information to the vulnerable populations. For example, I work sometimes in those just as a volunteer in an organization, and I find naked men having intercourse without protection, and we teach them to put them using their mouth, and that's a way to have self-care and hetero-care. So we must be realistic in the actions with the individuals. Every body, every life, every need matters. So we don't need to have any moralisms in our mindsets. When we talk to people, the lives we care are yours. I care mine, but I can do a whole effort so you care for yours. So your beliefs, your emotions, and your experiences will be as valid as mine.
I really like that. Family planning is a way for social justice, really important. Thank you very much, Minister. And Goodness, over to you.
Okay, thank you for that question. At the beginning of the year, myself and many of us, I believe, being caught up with the news on aid freeze and what that meant for losing jobs or projects being cut down, I had days of suffering from serious anxiety attack. It was that, oh, I'm just completing my master's. Where's the opportunity for me to get into the field when people who have 20, 30 years of experience have lost their job? But then I realized in thinking through this that this is not the most pressing issue. It is the communities we serve, that the funds needed to reach out to them are no longer available. That as you don't have those jobs, it means that the interventions, menstrual health, contraceptive uptake, reproductive services may not reach the people who really need it. And this brought about I and some of my colleagues in the power shifting subcommittee to design a toolkit that reminds us to take an equity pause. And what does that mean? An equity pause is that as we think about weighing the trade-off between equitable decision-making and the limited resources and how we have to make the most of it, how do we ensure that we are not leaving the most critical groups behind? And I'm enjoining everyone in this group to please make the most out of this resource. I think it was up a minute, okay, still up on the slide. This resource is hopefully requiring that we all take a minute to pause in that fast-paced decision that we are making on funding, on research, on selecting target population, to critically challenge the decision we are making, the process we are following through, the groups we are selecting. I'll just quickly go through some of the questions in the few minutes I have. One of the key questions we have is, who is missing and why? Whose voice is missing and why? Who are we ignoring or leaving behind? What inequities might we be reinforcing? How might this plan actually make things worse for marginalized communities? Are we addressing root causes or just symptoms? Are we solving problems or just reinforcing the issue? Are we designing for long-term impact or just short-term fixes? Who holds and we hold power in decision-making process? How does this reflect our values and commitment to equity? Are we actually living our equity values or just saying we do? How would we measure and adapt for equity over time? How will we know if we are causing harm or real change? So I want to enjoin you. This is available in Spanish, English, and French. To please take a look at this, challenge yourself, and maybe make some difficult conversation to walk the talk when we say we are translating equity in actions. Thank you.
Thank you. Dr. Dutt?
One of the things that we're witnessing alongside the loss of more than $80 billion in financing in this area is the growth of forces that are pushing ideas of family and contraception and gender and human rights that undermine the work that we have done these many decades. One of the networks, one of the regional networks that Hewlett has supported over the years is ODAS in Francophone West Africa. And in addition to several very important accomplishments at the country level, what ODAS has been able to do is attend to these growing right-wing movements, these anti-right movements, from a local regional perspective, and really put forward what it means for us to be talking about family and values from an African context that promotes justice and dignity for everybody. As part of that same theme, we've supported Afrobarometer, which is an organization on the African continent that does surveys and gathers information about a range of issue areas, and we've asked them to add reproductive health questions, particularly attitudes towards contraception and abortion, into their surveys, and we now have data from more than 40 countries that is also helping us attend to how to respond and encourage governments to be responsive to the needs of their constituencies. There is increasing look at how resource generation can happen within African governments. And so another one of our grantee partners, the African Tax Justice Network, is working with governments to figure out how to increase tax revenue, but how to do it in equitable ways, how to not add tax burdens on those that are already marginalized, but to figure out how to do resource generation in ways that they can attend to the big gaps in health budgets and education budgets that the funding cuts, the global funding cuts, have created. More importantly, the cuts have demonstrated how aid continues to operate in old colonial, unjust ways, and how power needs to be renegotiated and reconstructed from the ground up. And so we are also a part of many conversations that are reimagining aid in the first place.
Yes. And over to you, Pascal.
Great, thank you. I think that the first challenge that none of us can ignore is the tightening of fiscal space. And while things are broken, and whatever the catalyst was, for where we find ourselves, I think it does present an opportunity for us to be proactive in the rebuild. And for whatever movement we still have left, I think that there is an intentionality that is required to make sure that SRHR is not the first item that is cut when budgets shrink. The second challenge that I want to raise is the backlash against rights in science, very much in our kind of our basket of things that we're looking at. And the response, again, has to be that we have to remain steadfast and push back against the fact that evidence is not ideology. It is the foundation of good governance. And one of the things, I'm not sure I'm allowed to talk about it yet, but we are working on a chat HRP, which is an opportunity for evidence and for any SRHR-related questions to draw from the resources, the guidance, the norms and standards that WHO produces. We have to learn to communicate better. And again, this is, I think, an opportunity for us to think about our messaging and think about the audiences, stop communicating just in echo chambers, take a very heavy dose of humility and learn to listen and to adapt. And the third is just making sure that we're aware in our opportunity to rebuild that we address the fragility of the health workforce. Without fair pay, safety, and respect, even the best policies will fail. Other powerful opportunities, I think, are that countries are taking ownership. So that this is a role for us to really lean in and support those national plans. Digital and self-care innovations are a really important part of the future, particularly for adolescents and people in humanitarian and remote settings. And finally, recognizing the power of regional bodies from Africa, the AU, Lusaka Agenda, Latin American Feminist Financing Coalitions, and so on, are providing really new and exciting ways of looking at things. Thank you.
Supongo que voy yo. ¿Sí me escuchan?
My turn? Yeah, I think that's my turn. I have high blood pressure. I've been having those struggles during these days. I agree completely that we need to reimagine ourselves within the next 20 to 30 years, fighting for the health rights and SRHR. But we're not going to do it by our own, and we should not do it by our own. I think that we all need to go and try to find a transformative justice, an intersectional one. We said, and we continue saying from IPPF, that it must be make it political with key agendas and key governance out there. But now the idea is to make it political here, internally, how together we can find the transformative justice that we all need so we can have access earlier to the rights. This social justice must be transformative for many reasons. In the early colonial inheritance, there is something of these colonial injustices that we have with us, like classism, discrimination, and racism. Someone must pay for that? Well, no, and apologize is not enough. I think that what we need to do is to find a transformative justice, inviting us to heal together and to walk together. I think that the intersectionality is a possibility to do it, but there are two types of intersectionalities. The most known one is the one that describes the multiple vulnerabilities that one person where they live, could be a woman with disability and migrant, shows the degree of vulnerability. But intersectionality is just there, the one mentioned by Kimberly Christian. And I think, and I believe, and I connected with what I said before, we must connect, but we are stopped collaborating. We need to transit from one descriptive intersection to one more collaborative, because our movement must be interested on the environment. Yeah, of course, that's an ethic responsibility. Why the indigenous and people with disability must care? Why do we need to take care of those women working in their households? And why feminism today should be a partner of our movements? And that intersection of collaboration must happen now, today.
So, Dr. T, you asked about emerging challenges and opportunities in achieving universal access to family planning and sexual and reproductive health services through just and equitable approaches. And here's the thing. The challenge, the core challenge, is that we are a long way off universal access to family planning and sexual and reproductive health. We are a long way off the SDGs. Some of them are going backwards. We have much work to do, but that's why we're all here, and that's why we are all here in Bogotá, in community, despite the challenges and earthquakes we've been feeling in this sector over this past year. The other challenge and trick is that programs that focus on equity are not the low-hanging fruit. So those are not the easy wins for training a lot of people or serving a lot of people or doing things that get counted and measured in log frames and work plans, right? When we really center communities that have had the fewest opportunities, it takes more work, more partnerships, more time, more travel, more distance, more languages, and those are good things. We should embrace that. But it's not a fast track to universal access and to universal health coverage. I think that we need to recognize that the pathway to universal access to sexual and reproductive health is to ensure that each person in each community has equitable access. No one should have less access because of who they are. We're a long way from everyone having access, but you shouldn't be at a disadvantage because of who you are, because you are young or have a disability or are in a minority race or ethnicity or religion or in a humanitarian crisis or a climate crisis. That should not disadvantage you, but we just need to do all of the work to lift up everyone. So I think that we need to support all of these ways of integrating. We need to both integrate and sort of specialize in ensuring that these communities have this extra access. We have to mainstream inclusive practices, we have to mainstream these principles, and then we have to ensure adequate attention and resources to the implementation of activities that specifically meet the needs of underserved groups. We have to do it all. So it's lucky there's so many of us here to do it.
Thank you so much. And to all of the panelists, as we've listened to you giving us insights from diverse backgrounds that you come from, you've addressed particular barriers, the importance of community-based led approaches, the role of course, data indicators, and closing the equity gaps and the different opportunities that you see. You also gave us insights around family planning programs that are inclusive, culturally responsive, and grounded in the lived experiences of populations. You've done a formidable work this morning. I want you to turn to the audience and give them a marching order, a call to action. With everything that we've spoken about today, we know that ICFP is a community of builders, of movement builders, of young leaders who one day do grow up and grow into being leaders of the world in the various countries where they are located, in the different multilateral system. And we know that many will be the ones who are setting the policy agenda of their countries. Many will become the health and care workers responsible for programming and giving services. How do we inspire and make sure that we capture this moment of ICFP 2025 in Bogotá? What are some of the things that you want the audience, all of us, to take away? Understanding what equity is. You've said it very well. It's an action word. So how do we then hold each other in these challenging times, but understanding that we are very creative, innovative as a movement, as a collective of SRHR experts? Because we know that we can't leave anyone behind. So what does that call to action look like? I'm going to ask you to kindly limit yourself to a minute, be very concise. Give us a clear call to action, what it is that you think we should do to move from inequality to equity and comprehensive SRHR for all.
Es difícil centrar las voces.
It's difficult to center voice when you have exclusive feminism that only recognize norm bodies and experiences that are only theirs, to center community voices and not only listen to them, and not to recognize that who have been silenced for centuries have with them the memory, the experience, the urgency of building a fair future, is to open those decision venues so that the people who have been ignored speak, the ones who have lived the violence, poverty, exclusion, the ones that know firsthand the barriers here that systems impose. I believe that having their words, their pains, their dreams is to have policies from the real life, not from abstract statistics. When decisions come from these dialogues, justice stops being theory and it becomes action, because nobody knows better what a community needs but the people who live in it and upkeep it day in and day out. Please, I invite you not to forget to focus the historic voices that have been included. It's not just to hear them. You have to make their words, needs, and lives begin to trace the path. 1 minute, please.
Challenge to you today is do not sacrifice equity on the table of the many very important considerations that you put into the decisions that you make on your programs, your projects, and your research. That equity do not remain at the back burner or an oversight or the last thing you put into consideration. And I also want to encourage you to have the humility to say, I don't know, to pause and to listen to the communities you are working with, to see them as collaborators and not just tick a box that we have them in the room in a tokenistic manner, but working with them collaboratively to see that result or impact you want to achieve. And to all the young people in the room, I want to encourage you to be bold and to speak truth to those issues because, like myself, I strongly believe that we are the solution, and this is an opportunity as we are experiencing all the shift and changes to tap into and maybe to break all the structures and rebuild. But I hope that we take some actions from this. Thank you.
Thank you.
The old order is crumbling around us. And the question is, who are we going to be at this time? And we need many, many different roles and voices and players to help us allow what needs to die with dignity, to protect what needs to be protected, and to build the new. And so I invite you all to think about becoming architects and builders of what might be in this time of deep transition. And in that building of the new, I invite us all to imagine different economic structures, a different relationship with the earth, and how we live in reciprocity with all of the beings that we share this planet with. What does it mean to move from a system that has been based on division, hierarchy, and oppression, where othering is the norm and the core of how we have built everything? What does it mean to move from that to create a system where interconnectedness, reciprocity, care are the cornerstones of how we choose to live with one another and this earth?
And I'll cheat a little bit and amplify what my colleagues have said. I totally agree with all of that. That equity cannot be delivered for communities, it must be shaped with them, which means that we have to be absolutely intentional about valuing equity and acting on it. So what I would say, or what I would add, is that we need to hold ourselves accountable as a call to action. Every single one of us, if we're interested in this. We hold ourselves accountable and hold us accountable to demonstrate how we are actually going to do all of this lovely discussion that we've had. And that all the reports are not that, certainly from WHO, are not just about coverage, but acknowledges and actively seeks to shine a light on where our potential blind spots might be and what we are going to do to make sure that we address them. Thanks.
Thank you, Pascal.
Hola? Okay, yeah.
Hello, here. I am going to leave with this plenary session that I can dream. That yes, I can dream, but I don't have to be a romantic. We need to dream, but not become a romantic. That is a rule of thumb that I would like you to follow. That there is a transgenerational process. We should dream, but not become romantics. Next week I'll be 50 years old, and I think youngsters should be here with a greater presence. That makes me think that ever more we need to build a common beat, that heart that you were talking about that was so marvelous, because even in that heart, the color that we should call to action in the next 20 years, in the next 30 years, is that red of passion that we need to bring along to accompany other colors and other tides I think that is important time to turn political, the debate outside, but also to make it political, to turn it political, our debates in here. We need to grow. And this can only be done leveraging the movement, investing in our movement, investing in new ways of connecting, of knowing, and above all, of collaborating with the other. To forget thinking that the other is a source of disruption, to allow that metaphor of the field where that parcel, you have to open that little door of that parcel of land to find out what kind of grass is being grown there. As long as we cannot open that door, there's no possibility to be able to know the wealth and the diversity and the value that the other has in this world. We're going to leave this world, yes, but please do not deny our leaving to know other peoples before we go. Thank you very much.
This row, that's a
Yep.
lot of calls to action. And I know, Dr. T, you're going to sum up from there. You know, this should be so straightforward, but somehow we find it hard. I really appreciated that Goodness is encouraging young people to be bold. We want communities that have been historically disadvantaged to lean in, be bold, be loud. But let me speak from the perspective of a majority community and you know, Global North organization, that we need to listen. We need to commit to do better. We need to listen. We need to ask. We need to learn. We need to be curious. We need to be humble. We need to let people speak for themselves, and we need to really hear them. We need to get out of the way. We need to remind each other sometimes to be quiet, because we need to make sure other voices come into the conversation. The voices that have historically not been included, that we need to hear loud and clear to make the difference that we all want to make. Use the equity pause checklist that Goodness shared and focus on justice. Maybe my final call to action is let's focus on justice, let's focus on fairness, on impartiality, on access, on liberty, and on voice. And that's what's going to move us forward as a field, as a sector, as organizations, as governments, as communities, and as individuals. So thanks again for the opportunity to be here.
You've made it very hard for me to summarize such a brilliant panel and interventions, but I do want to say that it's been clear from all of your different interventions that family planning work is work of body integrity, of autonomy, of community building, and that centering dignity is absolutely key, because the humanity of every individual, their agency, the right to make these particular decisions about their lives and their bodies is absolutely important. And trust is the foundation. You didn't use the word trust, but I feel it in the way that you speak, that it's fundamental in how we engage at the community level, at policy making, at the level of health systems, in programs, in how we even establish therapeutic relationships, because we have to be aware of how power shifts and moves, and who feels empowered to seek care, and who feels safer in a particular place to be able to seek care. And that in fact we should be inspired to be creative, humble, be quiet, be bold. This work is political, and that we must be innovative at the same time. And I think we must still, all of us, continue to advocate that those who are stigmatized, who are discriminated against, who perhaps are even criminalized, and we know how these set of circumstances lead to health inequity. So we must continue to advocate to an end to all systems of oppression that actually make our work not as successful as it can be. And third, by centering dignity, we promote health equity. And I think that is one call to action from my end, to say let's continue to center the dignity of all people, regardless of what makes them marginalized, regardless of what systems of oppression makes them vulnerable. And that equity through action, like all of you have said, is something we must do as a commitment. And that every human being can realize their sexual and reproductive health rights and live in a community that's conducive to a life of dignity for themselves, first and foremost, and therefore for their communities as well. So thank you to the panelists, Her Excellency Manuel, Goodness, always good to share space with you, Dr. Malaika Dat, Dr. Pascal, Amaranta, as always, and of course, Tracy Bird for your incredible contributions. And just to say that there are people who are joining online, just to say thank you to all of you for choosing to join us, whatever time zone you are in, and all of you in the room in Bogotá. The hashtag is ICFP 2025. Please let this conversation continue outside of this plenary, and I know many of us are excited to build community with all of you as we move through equity into action and making sure that we can advance SRHR for all. So thank you very much for joining us for this panel. Thank you.